Hey gang, Brandon RN here. As the title says, today we are going to be talking about how to master NCLEX style questions. So a little bit about me. I, as you may know, am a nurse. I graduated December 2019 and I took my NCLEX right off the bat as soon as I could, and I passed it on the first time. Not 75 questions, but 76. So I am very familiar with the process, with the test, and I worked it the whole way through nursing school, and that helped me on the NCLEX as well. So this is going to be important for anybody who is starting nursing school. It's going to be important for anybody who is just about to take the NCLEX, or someone who might just want a little bit of help somewhere in the middle. So anyway, if you looked up this video, I'd presume that either you are starting nursing, you're somewhere in the middle, or you're about to take the NCLEX. Either way, probably a very scary time for you. We are going to start at the beginning. We're going to cover the basics of the NCLEX, talk about how it works, how the test is designed, and how you can pass or fail it. We are going to cover how to approach a multiple choice question on the NCLEX, and how to break down each step. I will tell you, it is a step-by-step process. It should be handled the exact same every single time. So I don't know if that brings you comfort or scares you a little bit, but if you follow me to the end, we are going to cover how to approach every single one of the questions, and it, like I said, should be approached the same every single time. And we're also going to cover my morning routine. As I mentioned, the test questions should be approached the same every time, but you should also have the same routine. So I'll go over my morning routine on the morning. I'm going to take a big test, whether it's through nursing school or through an NCLEX. Cover what's important for me, and maybe I can give you some tips and tricks as to how you can create your own morning routine. So please make sure you stick with me to the end, make sure you press the like and subscribe button, and we are going to get started. So now into the NCLEX. First thing you should know about the NCLEX is that it is adaptive. So what this means is that you're going to have a different test than the person next to you and different than the person next to you. There's a huge bank of questions, and it pulls from this bank of question based on you. So it bases each question, it's picked by algorithm, and the goal of this algorithm is to get you to get a 50% chance of getting it right or wrong. So it's a little bit confusing, but all the questions are random in terms of their body systems. They jump around a lot, and this algorithm has the goal you're having a 50% chance of getting it right or wrong. So if you get a question and you get it right, it gives you a harder question, because obviously you have a higher chance of getting the next question right. So it gives you a harder question until you get one wrong. When you get one wrong, it gives you an easier one. What it's trying to do is it's trying to get the level on of question that you're able to handle. So it tries to get a trend of where you're at. Once it can get that trend, then it can say whether you pass or fail. This can be anywhere from 75 to 265 questions. And if you get cut off at 75, that doesn't mean you passed, it doesn't mean you failed. If you get cut off at 265, it means the exact same thing. What it means is that it is either 95% sure that you are able to pass, or it's 95% sure that you're gonna fail. And it goes off of that trend of where you've been on how the difficulty of the questions that they've been giving you. So this is frustrating because you get out and it feels like you got half the questions wrong. Well, you probably did, and that's not any indication of how well you did. That's the algorithm. What is really important is the difficulty of the questions, and that is a lot harder to tell. So anyway, it's an algorithm. It adjusts each question at a 50% chance of whether you'll get it or not, and it's anywhere from 75 to 265 questions. If you get off at 75, it means you either did really well or really bad. 265, I had a hard time telling. Now it's time to talk about NCLEX questions. With these are, at least as of right now, all either multiple choice or select all that apply. Now there is some talk about this changing, so if it does, I'll have to make another video. But I'm going to teach as to what I took and also what it is currently. So with these multiple choice or select all that apply, there are a lot of different tactics or strategies that the NCLEX uses to try and throw you off. So these aren't questions that are simple, fact-based, do you know it or do you not? These are having to pull together all the knowledge that you took in through nursing school. You're going to have to go through pharm, you're going to have to go through leadership, you're going to have to go through all of that pathophys, all kinds of different things that you were taught in nursing school, and you're going to have to come to a conclusion that is both critical thinking, and it's also going to be action-based. So what that means is that you are going to have to think about what's going on with the patient, and then you're going to have to come with a conclusion of how, as a nurse, you're able to fix that. Whether that's asking for something from the doctor, but more than likely it's going to be a nursing intervention. There are 5 multiple choice type questions that the NCLEX is going to throw at you. And you're going to have to try to identify the question in order to help eliminate some of the options and come to the right conclusion. So starting off, the first one I want to talk about are false options. What this is it's just an option that it's not true. It's probably the easiest type of question that you will come across, and basically you're going to go through it, and it might be a correct intervention for some things, but you're going to have to interpret what the reason for the intervention is. So they're most likely going to give you some kind of problem with the patient. They're going to go over their symptoms, they're going to go over their history, and then you have to figure out what's wrong with them, and then based on what's wrong with them, you're going to have to come up with a proper intervention. There are going to be some that are true and some that are not true, and you have to find the right one. So that's probably the easiest one that you're going to come across, just because if you know what they're going for in terms of the problem with the patient and you know the proper things to do, you can easily narrow out which one is right and which one is wrong. The next type of question that I'm going to go over are priority nursing interventions. So these are absolutely the worst. So with these, you are going to have to go through, and just like every other question, they're probably going to give you a bunch of symptoms, and you're going to have to put a bunch of pieces together, and after you put all those pieces together, figure out what's going on in the problem, then you're going to have to come up with an intervention. And of your options of interventions, they're going to have 5 right answers. So you wonder, how do I handle that? So what you're going to have to do is you're going to have to find not the right answer, but the most right answer. And that involves finding the answer that is most specific for that patient. You're going to have to find the option that is the most broad. There might be 5 answers that all cover, or 4 answers that all cover part of one of the answers that covers all of those. So that's definitely a tricky situation to be in, but it is a well-known staple of the NCLEX and nursing school. So pay attention to that. Definitely a frustrating situation, but it happens all the time, and you really just have to find the one that's most specific, and you have to find the one that is the most broad. And I was actually told, when in doubt, pick the longest one. So definitely don't recommend it for every single time, but if you are stuck between 2 and you have absolutely no idea of these 2, I was told to just take a shot in the dark at the longest one. Don't stay on it for too long, because all you're going to do is mess up future ones. The NCLEX also absolutely loves to use questions that are priority based. So there are all kinds of different mnemonics that they teach you through nursing school. They teach you ABC, airway, breathing, circulation. They teach you fire, or sweep for fire. They teach you, I can't even think of them right now, but there are just an insane amount of mnemonics that they go through. And with those, it is best for choosing the order in which to do things. And this is another one, kind of like the best answer questions, where you have to choose between right answers. They say you find a patient who is found unresponsive in the mall, and you have to say what your first, that's a key trick, first or priority or any of that is an indication that you're handling this type of question where they want you to decide what's your next step. They'll give you a place in which you're at in this scenario, and you have to choose the next step. So if you find somebody in a mall who's unresponsive, the first choice is not going to be chest compressions. The first choice, following your BLS algorithm that we went through, I don't think all nursing schools go through it, but basic CPR, you have to check responsiveness first. You don't want to start compressions on somebody who is taking a nap, in the middle of the mall for some reason. But so you have to check responsiveness before you do anything else. And that's going to be true. It might be pretty obvious for that one, but it's going to be true for a bunch of questions. Just following those mnemonics. So learning those mnemonics and identifying that it is a first or priority question is going to be the best way to realizing that, hey, these all might be right. These all might be the right answers, but which one is the first thing that I'm going to do? Now, these last two questions that the NCLEX like to throw at us, I'm not as good at. These are tough and they're very niche-y. So we had maybe 1 or 2 classes that covered these, and you really have to put them in a different category than a lot of your other questions because they're so specific to one thing. The first one that I want to cover is developmental age. So what I mean by this is whenever you're going over peds, whenever you're going OB, so it's going to go over, okay, you have someone who is 39 weeks pregnant, and what would you say to report to your provider? So you have to know what the normal findings are at 39 weeks, and you also have to know what's abnormal. So you have to be able to figure that out, and that's just straight memorization. They might have a developmental age of a toddler, someone who is 2 years old, and what is an appropriate thing for them to be doing, or what should you report? So it's just a memorization there, and if you don't remember that, then it's kind of hard to answer those questions. You can think back to maybe someone who you've known, but that isn't necessarily the standard, so you really just have to remember what the book term is for that. Another question that would fall under that type of question would be the like immunization records. They say, what immunizations would you get at this stage of life, this many weeks, this many years old, and you just have to kind of remember that. So they have different algorithms, or they have different mnemonics, they have different ways of remembering that, but that's something that you just are going to have to put to memory. And the other one, this one isn't quite as much about memory, but it's definitely a niche one, is most therapeutic responses. So this is going to take you back to psych. And in psych, they spend so much time talking about the best way to respond to someone. What is therapeutic communication? What is the right way to respond to someone who is having a crisis, or maybe just went through a hardship? And in these, most of the time, it's going to be an open-ended response that goes towards feelings. So, okay, that must have been hard for you. Tell me about that. How does that make you feel? I know that that's something that you see in movies and all the time with the therapist, but it is the type of answer that they're looking for. Something that really focuses on their feelings, brings it back to them, doesn't focus on you, and is open-ended to encourage more communication from that individual. So those are the last two. And now, I don't think that any of this is very helpful if you don't have a clear mind. So to me, the most important thing before taking a test is what happens before taking the test. So that is doing whatever relaxes you, whatever gets you in the right mindset to feel good about yourself, feel positive, and be able to rock that test. So I'm going to talk about my personal routine before every single test, I would do the exact same thing, and it worked great for me. So even if it was a super early test, I would get up early, I'd shower in the morning, I would make myself a nutritious breakfast, and I would work out. Those were the three things that were staples towards me being productive. If it was a little bit later in the day, I'd still try and wake up. I really tried not to study the morning of. Sometimes it's a little bit hard to stick with that, with nerves and everything, but it's so important to not study, maintain nothing but good mindset, positive feelings about yourself and about your abilities, and just be able to go into that test with an open mind. I cannot stress enough the importance of a good breakfast and enough time to really get yourself in order, because nothing's worse than rushing in the day of the test, last minute, and you just don't have time to think through, and you're so rushed and you can't think through all these options I just gave you in terms of how to approach questions, and just how all of it works. So thank you so much. If you stuck with me to the end, please press the like button, press the subscribe button. A lot more goes into these videos than you may think, and I'm so glad to have you. Stick with me for next week as we go into our next topic. Thank you so much.